And now I will pass it along to Nurse Ashley from Employee Health to provide additional tips and information on the health clearance process.
Thank you, Ruth, and thanks to everyone joining and offering your time to volunteer with us. As Ruth said, I'm Ashley. I'm one of the nurses with Employee Health, and we are responsible to medically clear all the volunteers at Sinai. I wanted to point out some things for the health clearance process that will help expedite things for everyone. These are all questions we have received over the years from past volunteers, so I hope it will be helpful for everyone. I wanted to start with one of the tip pages here. It starts talking about toxicology testing. So let's summarize some important points for the toxicology testing. Now, the urine drug test, it's done with Quest Diagnostics, not your primary care provider. The drug test is no cost to you, and it can be done in any US state. So, for example, if you live in Jersey, you can still do the drug test with the order we send you. That's the next point. You will be emailed a Q passport, what we call, which is a electronic barcode order with instructions on how to complete the test. And next, keep in mind, this test is time sensitive. The expiration date of the test is going to be at the top left corner of your Q passport order. Legalized recreational drugs for New York State are not tested. If you are on any medications that could trigger the drug test, for example, an ADHD medication, Quest will call you directly for further information. So keep an eye on your phone a week after doing the drug test, as they usually call from what would look like a spam caller. It's usually a 1-800 or 1-888 number usually. Once the drug test is done, it's only valid for 3 months during the onboarding process. Please keep that in mind. For example, I had a volunteer who did a drug test in February and then submitted onboarding materials in November. That drug test is no longer valid and would need to be repeated. Our department, Employee Health, will get sent your drug test results directly. Your primary care doctor does not need, or whomever is signing off on your clearance form, does not need to sign off or attest to the drug test. Your drug test results are not needed to complete your physical exam or to complete the EHS volunteer health clearance form. Once at the testing site, just a reminder, if Quest marks that you refuse to test, you will not be granted clearance to volunteer. All right, now let's take a look at the health form. Now, whoever is completing your health form, it is their job to read what is required. However, I know sometimes people are busy, things can get missed. Therefore, I simply want to give you all as much info as possible. The health form itself is 2 pages, and it cannot be bypassed. If you are doing any blood work done, please be sure to attach the lab reports to the health form. Let's start in order. Point number 1, the physical exam point. Must be within the last year. Only a date needs to be written in there, nothing further. Point number 2, I want to look at in detail because there is a lot of wording there and it can become confusing. You have 2 options for the TB testing. You can do either 2 TST skin tests, or you may also hear them be called PPD skin tests. You'll see line there, TST number 1, TST number 2. Or you can do the quantiferon gold blood test. Now, you and your doctor, whomever's filling out your form, can decide which option is best for you. Most people prefer the blood test if they have that option available because it is less time consuming than the skin test. I really want to point out the time frame requirements to pay attention to there on the right in parentheses for each. Please pay attention to those. If you submit tests outside of these time frame requirements, the test will not be accepted. You will also notice there is a chest x-ray line there. That is for a certain circumstance, and the circumstance being if you have ever had in your lifetime that you're aware of an abnormal or a positive result for a skin test or for the quantiferon gold blood test, then you can do the chest x-ray option. The x-ray must have been done within the last year, and the radiology report must be attached as it notes there. You would also want to either attach or have the provider, whoever's filling out your form, write your past abnormal TB test result as well. So we understand why you're submitting the chest x-ray option. Moving right along, let's look at number 3, MMR and varicella. They both have the same requirements as you read it there. It's either 2 vaccines in your lifetime. The dates do not matter on the vaccines. Childhood doses, recent doses, it does not matter. Or you can do the antibody blood work, which is a titer, what we call a titer. You don't need to do both. One or the other is sufficient for our clearance purposes. Number 5, hepatitis B. You have 3 options there as it reads, yeah? So you can submit proof of a completed vaccine series. You'll see 1, 2, 3 there. Or you can submit, again, an antibody blood test. It's called a hepatitis B surface antibody blood test that shows immunity. Or you can sign a declination. Hepatitis B immunity is optional. We always encourage it for everyone. Hepatitis B is spread blood and bodily fluids. If you are doing a volunteer assignment in, for example, the emergency room, you would be more at risk than a volunteer who's doing an assignment, for example, in an office setting doing administrative tasks. So keep that in mind. If you still wish to decline, Ruth will give you our email and just simply request the declination form, and we're happy to send it to you. Flu shot. Flu shot is required for all on-site and hybrid volunteers. There are no exemptions. Tetanus shot. So you want to submit a Tdap vaccine in the last 10 years. If your Tdap or DTaP vaccine is over 10 years old, then you can do that TD vaccine there for your booster shot. And again, make sure that's within the last 10 years. So that's why there's 2 lines there. Number 8, it's a yes or no question. Please ensure whomever's signing off on your form answers this. We get sent perfect health forms, and this question is missed, and the form will be rejected. So please, if you have a chance to review your form before uploading it into your Visa's portal account, please ensure that this is answered. And then once all is said and done, the form must be signed and stamped by a provider. So that's any nurse practitioner, physician assistant, or medical doctor. It doesn't have to be a primary care provider specifically. Many volunteers who don't have a PCP, they go to CityMD, MedRight, community health centers, CVS Minute Clinic. All of these places have signed our volunteer form in the past. A specialist doctor, if you have, for example, a specialist doctor you have a good relationship with and they are comfortable signing off, that is also acceptable. So I hope all of this information was helpful. I'm going to turn it back to Ruth now to follow up with everything else. Thank you, everyone, for joining.
Thank you, Ashley.